Hi, everyone, and welcome to this week's edition of Central Florida Spotlight. Let's go to my first interview with State Representative Carlos Guillermo Smith. He's a Democrat representing District 49, and he is the one who sued the State Department of Health over coronavirus case numbers, arguing that the state has withheld vital data that can be used by the public to stay safe. A trial in this case is now scheduled for later this week. And Carlos, you've been busy battling the State Department of Health over coronavirus case numbers, and the case actually was in court earlier today, where the judge set a trial date for later this month. That has to be encouraging, I would think.
Absolutely. You know, today was another bad day for the DeSantis administration in court. Judge Cooper overruled their objection and allowed major news media organizations to intervene in support of our lawsuit for COVID-19 data against the state. They also tried and failed to delay the trial, which has now been scheduled for next week on the 29th and 30th of September. And Judge Cooper was skeptical about the state's argument and their repeated claims that only they can decide which COVID-19 data is confidential and exempt from public records. The reality is that Floridians have a constitutional right to freedom of information, and that includes access to COVID-19 data so that they can make informed decisions to help protect themselves and their families. The DeSantis administration has refused to release that data consistently, which isn't just bad governance, it's against the law, and that's why we're suing them.
If I'm sitting at home and I say, uh-oh, another lawsuit may cost taxpayers, why is it important and why must this happen?
Well, the reality is that it's not just public officials or even school board leaders who need access to local COVID-19 data so that they can make informed decisions to protect themselves, to protect students in school. Folks need to get the answers to basic questions, which they can't get right now. For example, if we were to try to find out how many children are currently hospitalized with COVID-19 in Orange County, we can't get that information from the state because they stopped releasing the detailed breakdown by age of COVID-19 hospitalizations in our area. It's not like we're asking for patient names and social security numbers. It's not confidential as the state has claimed it is.
The state, to your point, ceased daily updates to its COVID-19 dashboard back in June, I think it was, switched to weekly reports with fewer details. Why do you think those changes were made? Is there some sort of hidden agenda here?
Well, my fear, unfortunately, is that Governor DeSantis is withholding COVID-19 data to suppress the severity of this crisis. We understand that while hospitalizations and new COVID cases finally are on a downward trend from where they've been over the last 3 months, we also know that bad COVID numbers hurt Governor Ron DeSantis politically, and that is why I suspect he's been trying to suppress the severity of this crisis. But I just want to be really clear so that your viewers understand. They have a constitutional right to public health records as it relates to COVID-19. And when the DeSantis administration consistently refuses to release that data, it's not just that they're doing the wrong thing. They are violating the state constitution, and they need to be held accountable.
So the governor's spokesman, when we reached out, said in the past that the Department of Health does report its data, quote, routinely and automatically to the CDC. So is there a difference? And if so, what's the difference?
Well, the difference is, for example, we have long been seeking access to COVID-19 death data county by county so that we can fully understand the magnitude of how this is impacting us here locally. Now, we finally got some of that information last week, and it's not a coincidence that that was released just days before our pretrial hearing. It was released because they got sued, and so they're starting to release some of the data. But it's not everything that we asked for. We still need the detailed hospitalization information so that we can understand what age groups are being impacted, what ethnicities across the state.
Is it possible the Democrats also want these numbers out so that when he does run for re-election, you can say, look at how bad these numbers are and how he tried to keep them from you, the voter in Florida?
Well, the reality is that we will get access to this information eventually. But the reason why this public records lawsuit is so important is we need access to real-time information right now so that people can make informed decisions that can potentially save their own life or the life of someone in their family. And as they often say, public records delayed are public records denied.
Is it an overreach to say that healthcare workers and other leaders around the state, had they had this information at their fingertips, could have helped to prevent this recent surge in cases and deaths if the data had been available in a more complete and timely way?
Well, I can tell you certainly that one of the reasons why we filed a public records request, which was then rejected by the DeSantis administration, and then we followed up with this lawsuit, is because our own Orange County public school board members reached out to me and they told me, Carlos, we can't make an informed decision on what our school masking policy is going to be, for example, because we don't have access to real-time data. Had we had this information out there earlier, I suspect many school districts, in addition to Orange County, would have defied the governor and required masks in their communities as well. But they didn't get that information. And now we have learned that in the last 6 weeks that the number of pediatric deaths in Florida due to COVID-19 doubled, which is obviously extremely alarming. It's devastating for those families, and there's so much that we could have prevented.
Coming up after the break, more of my talk with Carlos Guillermo Smith and his take on whether releasing this data will save lives.